UK is seeing a dramatic surge in COVID-19 cases. Its health secretary says he is not ruling out Plan B contingency measures just yet.
We'll be staying vigilant, preparing for all eventualities, while strengthening our vital defences that can help us fight back against this virus.
Health leaders there are demanding an immediate introduction of restrictions to avoid what they're calling a winter crisis. The call comes as the UK recorded its highest daily COVID-19 deaths since March at 223. A Delta variant subtype is causing the growing number of infections. To talk more about that and the potential risks to North America, I'm joined by Dr. Angela Rasmussen. She's a virologist at the Vaccine and Infectious Disease Organization at the University of Saskatchewan. She joins me tonight. Dr. Rasmussen, good to see you.
Good to see you too.
I know you've been keeping an eye on this. Tell us more about this Delta subtype, also known as Delta Plus.
So this is the second Delta Plus actually that we've had that has popped up. And that's really not surprising because around the world, Delta has become the dominant variant. And whenever a variant of any kind is being transmitted widely, there will be new mutations that accumulate in that variant and what we call sublineages of Delta will emerge. And that's exactly what this is. This is essentially Delta that has two additional mutations in the spike protein. They are actually not in the part of the spike protein that binds the receptor. They're in a part that's right next to that called the N-terminal domain. And it really remains to be seen what the significance of this particular Delta sublineage is, although it does appear to be growing in the UK.
Okay, is it more contagious or more deadly or both, or do we not know yet? It's too early.
We don't know yet. It's too early. All we've seen is that there has been an increase and an uptick of the percentage of this particular sublineage in the UK where they do a lot of genomic surveillance. Now, this sublineage has been seen in Canada, although as far as I know, it's really been responsible for a handful of cases. It's really unclear at this point if this is more contagious potentially or more transmissible than original recipe Delta.
So you kind of answered my question there. I was going to ask why the UK and nowhere else at this point, but they do have very rigorous testing. So that could be the reason they're just picking it up better and faster than other places. Is that right?
That's right. The UK is really a world leader in what we call genomic surveillance. So they sequence about 10% of all of the positive COVID cases that they have. That's why they're so good at picking up these new variants shortly after they emerge. We are doing some of this type of work in Canada, and I'm a part of the Coronavirus Variant Rapid Response Network. We've been discussing this, but in many places, we still don't have the surveillance capacity to find these variants if they emerge. They also might not be emerging. We haven't really seen anything that indicates that this is becoming prevalent in Canada.
Do we know if the vaccines that we currently have are effective against this new iteration?
So we think that they probably will be. First of all, the vaccines that we currently have are quite effective against original recipe Delta. And as I mentioned, these two mutations that this particular sublineage has are in a part of Delta a part of spike called the N-terminal domain. Now, the N-terminal domain is important for antibody neutralization, but in Delta in general, the N-terminal domain is actually a little rearranged from what it is in other variants of COVID. So these two mutations, while we still don't know the significance, it's hard to say that they would have any impact beyond what Delta already has on antibody neutralization.
Okay.
And fortunately, this particular sublineage doesn't have any mutations compared to regular Delta in the part of the spike protein that actually binds the receptor. And that's really important for where antibodies can bind and prevent that virus from causing an infection. Wow. So I don't think right now, I mean, of course, we should wait and see. We should take a look at it, but there's really nothing that stands out to me as a concern as far as vaccine effectiveness against this particular sublineage.
Okay, good to hear. Appreciate your expertise as always. Dr. Angela Rasmussen joining me tonight. Thank you.